Today's our topic is related to the upper limb bones, including the clavicle and the scapula. First, have a review or a brief introduction of clavicle. So, clavicle is a S-shaped bone. It is a S-shaped bone. Okay, and it has two surfaces, or we can say it has two ends. It has two ends. One is the lateral end. It has two ends. One is the lateral end and second one is the medial end. Okay, so lateral end is also known as acromial end. Lateral end is also known as acromial end, and medial end is also known as sternal end. Okay, so we will see three views: superior view, inferior view and anterior view of the clavicle. Okay, so suppose this is your right clavicle bone and I'm going to show the superior view. Suppose this is the superior view of the clavicle, and let me show you. It is a S-shaped bone. It is a superior view. We are seeing the clavicle from the superior side. Okay, and let me draw it. It is a S-shaped bone. It is a S-shaped bone, and okay. So this one is the, suppose this is the right clavicle. This is the right clavicle, and this one is the lateral end. This one is the lateral side. Okay, this one is the medial side. So we can see that the medial side is a little bit convex. The medial side, the medial portion of the clavicle is a little bit, or we can say it is convex. It is convex in shape. Convex means it curves is directed outside. Its curve, the curve of the medial part of the clavicle is directed towards outside. It is directed a little bit outward. Okay, so that's why it is convex in shape. And if we talk about the lateral side, so the lateral side is a little bit concave in shape, because its curve is directed inside. Its curve is directed, this curve you can see, this curve is directed inside, and its curve is directed outside. Okay, this one I am talking about, this curve is directed outside and this curve is directed inside. So when the curve is directed inside, that shape is the concave shape, and when that curve is directed outside, that shape is known as convex shape. So the lateral part of the clavicle is directed inward and it is concave, and the medial part is directed outward and it is convex in shape. Okay, so it is a S-shaped bone. Now this lateral part of the clavicle has a oval shaped facet for the articulation of the acromial process. Now let me draw the scapula, which is another bone of your upper limb. So this is the right, I'm going to draw the right scapula. Okay, this is the right scapula, and see, okay, I'm going to draw the right scapula. Okay, and this one is your clinoid cavity, and okay, this one is your clinoid cavity. This one is your cricoid process, coracoid process. This is known as coracoid process, and then there is another process which is of our interest. Okay, this one is the acromial process. Okay, this is the scapula, and I am showing you the anterior view of the right scapula. This is the anterior view of the right scapula. So scapula is a bone, and it has three angles. It has three angles. Okay, three angles. One is the this one is the superior angle. This one is the superior angle. This one is the okay, see it. This one is the inferior angle. Okay, this one is the inferior angle, and this one is your medial angle. Sorry, one is the superior angle, second one is the inferior angle, and the third one is the lateral angle. Sorry, there is no medial angle. And the lateral angle, remember that the lateral angle is formed by this glenoid cavity. Remember that glenoid cavity is the cavity for, or it is acting as a facet for the humerus. Actually, it is a site of articulation for the head of the humerus. So this is the glenoid cavity, and glenoid cavity is a site of attachment for head of humerus. Now I have told you that scapula has three angles and it also has three borders. Okay, and this lateral part of the clavicle, which is the acromial end, it articulates with the acromial process of the scapula. Okay, basically acromion is a process of the scapula, which projects anterolaterally and arches over the glenoid cavity. It projects anterolaterally and it arches over the glenoid cavity, and glenoid cavity is a site of attachment for the head of the humerus. I have already told you. Okay, now actually the acromial end of the clavicle bone has a oval shaped facet. Facet means the side of attachment. Actually this side, it has a oval shaped facet or side of attachment, which articulates or attached with the acromial process of the scapula. Okay, now let me show you the posterior view of the scapula. Okay, posterior view of the scapula. Okay, 1 minute. Now let me draw the posterior view of the right scapula. This one is the now I'm going to draw the posterior view. Remember, you have to remember which side of the scapula I am drawing. This is the right scapula, and posterior view, right scapula and posterior view. Okay, so okay, this one is the glenoid cavity. Now it is on the medial side because I'm going to show you the posterior view. Okay, posterior view, and this one is the medial border. This one is the medial border. This one is the superior border. This one is the superior border. This one is the medial border. This one is the superior border, and this one is your lateral border. Okay, now this one is your superior angle, this one is your inferior angle, and I have already told you that the lateral angle is formed by the glenoid cavity, which is a site of attachment for the humerus bone. Okay, head of the humerus. Okay, so basically the posterior view of the, or we can say the posterior surface of the scapula is divided by the spine of the scapula. So here is the spine of the scapula, and the terminal portion of the spine of the scapula, yes, it forms the acromial process. It forms the acromial process, or it divides the posterior surface into the two regions. One is the supraspinous fossa, and second one is the infraspinous fossa, and this one is the acromion, which is a process of the scapula which articulates with the acromial end of the clavicle. Okay, now remember that the region between the now this is your lateral angle, this is your the glenoid cavity is equivalent to the lateral angle. This is your glenoid cavity, and it forms a lateral angle. Okay, lateral angle of the scapula, and between the lateral angle of the scapula and the attachment of spine, between the lateral angle or glenoid cavity and the attachment of the spine of the scapula, there is a notch. Beneath this there is a notch, or we can say there is a cut, there is an incision known as greater scapular notch, and okay, again let me give you a brief explanation again. This is the greater scapular notch. Okay, remember that the posterior surface or posterior view of the scapula is divided by the spine of the scapula into the two regions, into the two fossa. Fossa means depression. One is the supraspinous fossa, second one is the infraspinous fossa, and we know that the lateral angle is formed by the glenoid cavity, which is the side of attachment for the head of the humerus, and between the lateral angle and the spine of the scapula, there is a notch. Which is acting as a communicating channel between the supraspinous fossa and the infraspinous fossa, and this is known as greater scapular notch. Wherever the word notch is written, it means cut or incision. Okay, incision. Now this is your acromion, glenoid cavity. Okay, now if we talk about the coracoid process, every time I made a mistake in its pronunciation, it is a coracoid process, and coracoid process also projects anterolaterally. Okay, anterolaterally, just inferior to the clavicle. Now remember, there are two muscles. One is the long head of the tricep brachii muscle, long head of tricep brachii muscle, and second one I am going to talk about the long head of bicep brachii muscle. This is C. Okay.